I'm Ngufor. I'm an associate professor of biomedical informatics at Mayo Clinic. Actually, my talk is really a great follow-up from the talk on PTSD. So imagine George with PTSD and just been told you have prostate cancer. And you can imagine the emotional, psychological that can compound on the existing comorbidity. So let's get it. No disclosure. I'm not going to go through it, but for the learning objective, basically we're going to describe the role of AI and extended reality in prostate cancer care. And we're going to discuss the potential of a platform that we're going to introduce in this talk in addressing health disparities and improving psychological outcomes in oncology. So let's start with background. So prostate cancer, mostly diagnosed cancer among men in the United States, and significant disparity exists in the Black community, especially faced by Black men. And how is this? High mobility, high mortality, and advanced stage and diagnosis. In fact, Black men are twice as likely as diagnosed with prostate cancer than any other race or ethnic groups. They are mostly diagnosed at advanced stage, and the incidence is high. Why the incidence has really stabilized over the past couple of years, but these disparities increases. We don't really understand why, and that's why research like this is important. Now, our talk is mainly focused on the significant unmet psychosocial, emotional, spiritual, and social determinant of health that exists. So many of these men, when they are diagnosed, they really don't have the support that they need at the point of prostate cancer diagnosis. So a motivation for this study was really based on our study. Participants, they mostly expressed that when they are given that terrible news, most often the clinicians are busy. Of course, they are busy because they need to attend to other patients, but they mostly left these patients without support. Like the psychosocial support is not there, the social determinant of the support is not there, the emotional and as well as spiritual is not there. So one patient in our study actually expressed that when he was given that news, and he felt terrible, he felt dangerous in the sense that he could have jumped into his car and drive and got an accident because there was nobody there to actually offer him the support that he needed, just to talk to him, hold his hand. And that's why we start figuring out, if there's nobody there and there's nobody to actually talk to this patient, maybe we can bring in AI or we can bring in virtual reality to help provide that support that the patient needs at the point of prostate cancer diagnosis. So, traditional approaches, limitation, as we know. So typically delivered through direct face-to-face interaction, as we know, or traditional audiovisual materials. But the barriers here, as you can imagine, include limited accessibility, cultural insensitivity, and inadequate engagement. There is need for innovation and culturally responsive solutions. Now, what do we mean by cultural insensitivity here, or cultural sensitivity in healthcare? This is the aspect of understanding that patients' cultural beliefs and behavior impact the care, and then you adjust your treatment or your diagnosis to meet their cultural background, especially communication and the treatments. That's what cultural sensitivity means. So, we introduced ViRA, and ViRA is really an innovative AI-integrated extended reality platform to address psychosocial need for prostate cancer patients, especially for underserved communities. So our initial cohort here is really to design for Black men with prostate cancer. But the platform can be applied for any man with prostate cancer, either at the point of diagnosis or during survivorship. So it combines virtual reality technology, AI-driven personalization, and culturally resonant content. You're going to see that as we go. So let me give a quick overview of the platform. First, we have to onboard patients into the platform. So what we do is we go through a quick recap survey that can be completed in 2 minutes or less. And why we do this? Because this is at the point of prostate cancer diagnosis. You've just been given the news that you have prostate cancer. Imagine the barrage of psychosocial feelings that you might be going through. And then you have to go through a long survey, 15 minutes. No. Quick psychosocial intervention, questionnaire that will answer some brief questions about your psychological state, for example, the anger, the shame, the blame, the loneliness that you feel. Then we are going to apply an AI model to personalize the intervention that you're going to receive in the next, what type of interventions are done. So, and then when you're in the virtual reality, you're going to be guided through an assistant to go through the interventions, but you're free at any time to choose whatever intervention that you want to interact with. So let's look at the intervention. Again, back on from our research, we realized and we saw from the men that they relate more to other prostate cancer patients that have gone through this survivorship. So we talked to so many of these men, they keep saying, look, we show them videos of other interactions. They relate a lot to those interventions. So we think, well, maybe we can do the same thing, but now in virtual reality. So the intervention is really, the initial intervention here is really having a group of prostate cancer survivors or advocates or even community leaders that are actually advocating for prostate cancer, maybe in a group-down conversation, real conversation, raw. We are not editing the conversation. The men will just talk about their life journey, how they got the prostate cancer. So basically they'll discuss the things that they went through, the mistakes that they made, the treatment that they could do, side effect, and it will just be like open conversation. One person will be moderating the conversation and asking questions and also giving them back his own experience. So it's really like that community So we had these sessions with the group of prostate cancer men sitting together and talking. We also have the psycho-oncologists meet one-on-one or in group session, where we also have community leaders, as I mentioned, that do not have prostate cancer, but these are more like a line of caregivers to sit and talk with these men. So we take these videos and then we convert them into 3D virtual reality modules. And these are long, huge videos, so we have to chop them up so that it can fit into our virtual reality workflow. So basically now, the point is, we have this large number of data. We have to figure out within each session how the prostate cancer, the patient that has just been diagnosed, is going to interact with. We can't have you to look at this video for 30 minutes, so we chop them into 5 highly content about the prostate cancer. So that brings us to the AI. So in the AI personalization, what does that mean? So we have these videos, we collect the transcript of the videos, and then we apply a large language model. This is a large language model that we locally deployed in Mayo Clinic, so it's fully secure. And then we have the large language model to rate the transcript. Rate the transcript in terms of themes, like what are these men discussing in this particular video segment. They could be talking about shame, they could be talking about, erectile dysfunction, spirituality, and all that. So it grouped the videos 10 into chunks of content, and then level the content in a user-friendly manner. So each of these content are now embedded into the virtual reality so that when you go through the record survey, and then you answer that quick question, we're going to figure out which of these modules we should have you interact with first. If a man at the point of prostate cancer diagnosis expresses that he feels a lot of shame or blame about the prostate cancer, we don't want you to get into the video and start talking about spirituality, because that will not help you at that point. We want you to engage with the video that is talking about shame, where the men are discussing about shame, how they experience it, or talking about erectile dysfunction, if that's what you express during your red card survey. So that's where the AI comes in. Now, when you apply a large language model to rate videos, it typically will make different, give you different ratings. So what we do, we run it multiple times and then aggregate. These results were then validated by our team, and most often the model was spot on. If I'm just running it multiple times, I would just say, oh, this is perfect. So next, I want to discuss about the technical challenges, the technical development. Our initial proposal was to have our virtual reality content streamed directly from the Mayo Clinic cloud. So basically, we deployed the NVIDIA Cloud XR application that will stream all content directly to the headset. Like I mentioned, the virtual reality content are huge. They cannot all fit on, say, the Meta Quest headset because we have this large database. So think of just streaming it directly from the cloud. But unfortunately, we run into some performance issue with Cloud XR, so we're currently in talks with NVIDIA to try to fix this issue for my team. So we then pivoted to just deploy only a segment of the video, like 10 modules at a time on the headset, so that it's locally embedded. Another thing that we realized again in the virtual reality, again, we can't really use augmented reality here because we really want to embed the patient in a culturally sensitive environment. I didn't mention about the cultural sensitive, like the video that let me go back a little bit. Okay, so the cultural sensitive here, you see the men are sitting. Where? They are sitting in a barber shop. And we are talking about black men. Black men, as you probably have heard, they typically relate to their barbers. So that's one aspect of the cultural sensitivity that we're trying to address. We're able to develop modules like in the church, in the mosques, areas that are culturally sensitive. It could even be in the street of, say, New York, where they really relate to, like men playing chess, playing checkers or so. Those are the little aspects that men relate to, or any other prostate cancer. So I just wanted to go back to that I missed. Yep. We're here. Okay. We'll be back. Okay. So user testing and validation. So after doing that, deploying on the Mayo Clinic cloud and pivoting to a headset, we now have our prostate cancer patients. Here we have our prostate cancer patient. He is actually a prostate cancer patient that is part of our research group. He's a prostate cancer advocate. So we have an initial testing. And what they do actually realize was this is very engaging, it's stable, and it's culturally appropriate. So the feedback now provides us with more data to go back and refine it. And we are currently actually engaging in a beta test. And that beta test, we're going to enroll about 50 men. We actually have already enrolled 6 men and actually carried out the intervention. The initial results are just like goosebumps. So the men are really related to this application. We are funded by the DoD. And the DoD phase 2 of our grant is actually to conduct pragmatic clinical trial, which we are going to enroll for 200 men in Florida. So, community engagement is also another aspect of this work. So, next month is going to be prostate cancer month. We are engaging in our community outreach. Again, like I mentioned, we have community, strong base of the community integrated into this application. So, we also have a Plan 2D application where these virtual reality videos are going to be converted to 2D and deployed as a web. Again, I mentioned we are trying to serve underserved communities. Most of them may not be able to afford virtual reality headsets and all that. So the 2D version, which will not be immersive, but it's going to provide them with the support that they need. And I also mentioned about the social determinant of health. Now, when they engage into the virtual reality, they are going to have support within their neighborhood about where they can go and get support. For example, they can get financial support, housing support, medical support, or transportation support within their environment. So almost at the end, so clinical implication will address the gap in psychosocial prostate cancer care and potential, of course, to improve quality of life. Next, conclusion, ViRA represents an innovative approach to psychosocial support, technical stable, culturally tailored, and clinically validated through our initial testing. For future direction, we want to do, as I mentioned, conduct comprehensive beta trials, evaluating the clinical outcomes and adherence. Then further we refine the performance, and then the cloud integration with cloud video, as I mentioned. And then cross again, we really want to expand. And then the other component which is critical is digital literacy. You can't bring an application like this that's high-tech without actually training the population doing it. So that's where the digital literacy comes in. That's it. Thank you very much.